How deadly is lung cancer and how common is lung cancer in the Hispanic population?
Lung cancer is the most deadly cancer in the United States, and it's actually the #1 cause of cancer deaths for Hispanic men and #2 cause of cancer death for Hispanic women. So very common, very deadly, and we have a number of new things that are exciting to try to control the disease that we hope to talk about today.
Very good. I know now that lung cancer is the deadliest form of cancer. Is there hope for people who have been diagnosed?
Yes, there is. We have hope both for patients that we can actually detect the disease earlier, in which case we can cure it, but we also have hope in a number of exciting new developments that we can help our patients that have stage 4 disease or disease that has spread to be able to control their cancer and to improve their quality of life so that they can live longer and with fewer side effects.
Who should get screened for lung cancer, and how important is early diagnosis in the treatment of lung cancer?
The most important thing we can do today to decrease the number of cases of lung cancer in the U.S. is actually to stop smoking or have our youngsters not take on smoking. But for those patients that actually smoke, we do have ways of detecting the disease early, and that's with a low-dose CT screening, which is kind of a mammogram for lung cancer. So those patients who have smoked for more than 10 years, at least a pack a day, and who are older than 55, they should talk to their physicians, and they should consider doing this CT scan, which is a low-dose CT scan that helps us detect cancers, about 80% of cancers actually, at much earlier stages when we have a good chance of curing the disease.
Can you talk about the breakthroughs in cancer such as target therapy and immunotherapy and how they work?
Absolutely. We have seen a lot more breakthroughs in the last couple of years than we saw in the last 2 decades for lung cancer. And these are mainly targeted therapies and immunotherapies. Targeted therapies are treatments that have been designed to target and to block specific molecules that make the cancer tick, that make a cancer become what it is. And these treatments tend to be more effective and to have fewer side effects than those older chemotherapy treatments that we used to have, which are still important, but these targeted therapies are more effective and have fewer side effects. Immunotherapy is an even newer development. We have been using it for the last 2 years in clinical practice and a little bit longer than that in clinical trials. And these treatments actually takes the break away from our immune system so that our defense cells can fight and kill cancer cells. And we have seen a lot of patients live for many years, even with their disease spread to other organs.
How can patients get involved in a clinical trial, and what are the risks?
Today, very few patients actually get involved in clinical trials, and we do need to improve on that because it is these studies that lead to improvements that help us be able to control the disease for longer and hopefully eventually reach a cure for all patients with lung cancer. Involvement in lung cancer clinical trials can be achieved by talking to your physician and healthcare team, or to looking into NGOs and institutions such as the Lung Cancer Foundation of America. So if you'd like to check our website at lcfamerica.org, you can see ways that you can help this fight today, including how to donate so that we can increase the amount of money that we have to get new breakthroughs in lung cancer. Lung cancer today is the most deadly cancer in America, but we do not get as much money for research as we do for other cancers, so this is certainly a situation that needs to improve and that that the people that are listening to us today can actually help with.
Are there risks to a clinical trial?
The risks associated with clinical trials are the risks of getting a new treatment that is still being developed. Of course, we do have side effects from even medications such as aspirin and Tylenol, so there are risks associated, and it's important that for each study, each drug, the patient gets information on what the potential side effects and potential benefits are. Of course, this is very individualized and it's done on a case-by-case basis, but that's an extremely important point.
What can our readers take away from this interview?
Lung cancer is extremely common, extremely deadly, but we do have things we can do today to control this horrible disease. We can stop smoking, we can do CT scans to detect the disease early, and even for patients who have more advanced disease, we have a number of new breakthroughs that are helping them live longer and with much better quality of life.
Doctor, thank you. Millie, I understand you were just diagnosed in June. What did you think when you heard the diagnosis?
Sure. On June 22nd, my life had changed. The doctor called me and he told me that I had cancer. At first, I couldn't believe it because I never smoked. I never smoked, that I was not surrounded for people to smoke. And I thought that there was a mistake. You know, how could this be me? But after the news settled in, I thought about my daughters. I have 3 young girls, ages 9, 7, and 3. I thought about what are they going to do without me? Who's going to help them do their homework? Who's going to help them just with the everyday things? And I had lost all hope and didn't think that I would see them grow up. It was a very hard time and very difficult for myself and my family. And you know, at that moment, I had just lost everything. Throughout the weeks that passed, I found out that the cancer was not only in my lungs, but in my lymph nodes, in my bones, and in my brain. And that scared me.
Is it a myth that only smokers get lung cancer?
Definitely. Definitely is a myth. I never smoked, and I haven't. I think that sometimes when you think of lung cancer, or at least me, I thought of somebody who is older and who was smoking. But the reality is that there are so many people out there just like me, mothers, you know, with a lot of kids, fathers, you know, daughters who are getting it. And I am the perfect example of that.
Millie and Doctor, thank you so very much for your time. I know I have a limited time here, but you've both been very helpful.
Thank you. Have a good day.
You too.
Thank you.